The treatment of it's very simple. We use antihistamine eye drops. They take about a month to start working. They can't often be bought over the counter. There are some that can. There are also what we call mast cell stabilizers. So they basically stabilize the immune response that results in the symptoms that patients experience. In a very small group of patients, we need to use anti-inflammatory drops, which we now have available, and these drops are used throughout the year. We can often use them for about a year, and then if patients are stable, start reducing the dose. But we have some patients who are on them for many years. Sometimes the disease itself burns itself out, and sometimes children, very young in their first decade of life, can experience an aggressive form of allergic eye disease called vernal conjunctivitis that in extreme circumstances can make them go blind. I see a lot of allergic eye disease. I mean, it's very common now, especially in London, where it's a high level of pollution, and there are environmental factors here that may not get in, for example, the countryside, and so I see a lot of patients who will have quite aggressive forms of allergic eye disease. And it's very important in allergic eye disease to stop the cycle of inflammation, and that requires antihistamines and anti-inflammatories. And if that isn't done, then the disease can often persist into a much more chronic form, where it can have consequences to vision and the surface of the eye. A lot of patients who have severe eczema will have a form of allergic eye disease that's all chronic and all the time, and those patients respond very quickly to the treatment, and the first thing you often notice is that your itching goes, the redness and the watering then disappears. Some of the symptoms are very quick to disappear and others take a few months to settle, but usually by about 3 months we get to a state where the eyes are much more stable, much more normal.